Good day everyone, this is KYLENE MAE Tambaling, and today I will be showing and presenting to you my written demonstration about how to take the vital signs of a patient. And before that, we have to gather all our equipments for taking the vital signs. And we have to start with our BP paraphernalia. This is used to take and get the vital signs, or specifically the blood pressure of the patient. Uh, this includes a stethoscope, which will help us to hear and listen to the beat of our patients. And here we have a pulse oximeter, which is used to get the saturation oxygen of the patient. And here is a thermometer to get the temperature of our patient. This also includes in taking vital signs. This also includes different protective gears, which will help us to reduce the contamination of bacteria. Here we have gloves for our protection, and also for the protection of our patients. And uh, this also includes towel or wipes for disinfecting our materials, which we have used and we will be using on different patients. We have to remember that after we use the paraphernalia on a patient, we have to wipe them and clean them properly, and of course our face mask for our protection and the protection of everybody. With that, we are now ready to proceed on taking vital signs properly. With that, we are officially ready to take the vital sign of the patient. But before that, we have to introduce ourselves to our patient first. Ma'am, this is KYLENE MAE Tambaling, and today I will be your nurse. And of course, may I ask, is it okay to you if I take a vital signs with you?
It's okay, ma'am.
Okay, so the patient says that she is alright with me taking her vital signs. Ma'am, may I check your bond? Oh, it's okay. Now, after checking on the patient, we have to ask her name and also the date of birth. Ma'am, what is your name and what's your date of birth?
Elena Tambaling, my birth date is 1956.
Okay. After introducing the patient to the patient, and also after asking her the permission, we are now ready to take the vital sign of the patient properly. Ma'am, how do you feel right now, and what part of your body is currently aching?
My niece, that niece.
With the scale of 0 to 10, we have to ask our patient how does that pain feels. Ma'am, with the scale of 0 to 10, starting to 0 with no pain, and 10, which is the worst pain, how do you rate and how will you rate your pain right now?
I think only 7.
7. So after asking that the pain assessment of the patient, we are now ready to uh, do the other assessment on the patient. After knowing and assessing the pain of our patient, we are ready. We have to remember to take note all the details of the patient says. Let's start using or taking the vital sign of the patient using this pulse oximeter. The use of this uh, pulse oximeter is to get the oxygen saturation level of the patient, in which we will be inserting this device to the finger of our patient. But before that, we have to remember that on putting or checking or using this device, we have to choose the finger which the circulation level is working properly. And in here, let's start inserting this first. We have to turn on it first, okay, and then insert it on the finger of the patient and let it read. Okay, let's wait for a minute, second. Okay, the level of the patient is 98, and the oxygen level, which the normal level of oxygen saturation of most uh, of the adults is around 95 to 9 to 100. So technically, the oxygen level of our patient right now, which is 98, is just normal. And after that, after we remove this, we have to wipe this device and put our data. We have to put our data on our chart and put it properly and keep it here. So after gathering and putting or listing the data we have here, we are now ready to proceed on the other vital signs of the patient. We are now ready and we are now able to proceed on taking the vital signs, specifically the temperature of the patient using a thermometer. Note that in getting the patient's temperature, we have different routes, which includes, which may possibly be on auxiliary or orally or on the ears and the forehead of the patient. But technically, right now, we are going to use or we are going to get the temperature of our patient using a thermometer or are getting it over here, her auxiliary. And the use of this thermometer is technically to get the temperature of our patient. Let's start by opening and put it over the auxiliary of our patient. You have to wait for a second and until it stops. Okay. The temperature that the thermometer was able to detect was 36.1, which is just normal to patient. And after that, we have to wipe and clean our paraphernalia, this device, and then we have to put our datas on the, we have to document our findings on our chart. And now we are ready to get the pulse rate of our patient. Basically, on this part, we need no equipment to get the pulse rate of the patient. And instead is start with uh, locating the radio artery of the patient. Why radio artery? It is because on this part, we can easily detect and count on the pulse rate of the patient. And we are going to use our fingers. The first finger or the first three fingers starting with our index finger. So basically, this is my index finger. 1, 2, 3. So these fingers will be used to count the pulse rate of the patient. And where is the radio artery? Radio artery is currently and technically uh, found in the lower part of the thumb of the patient. Since this is the part of the patient's thumb, we're going to slide our fingers, and here is the lower part of the thumb, and we can count it and put our fingers here. We don't need basically to press our fingers on the uh, radio artery. We just have to put it lightly and we can read it already. And on reading it, we have to wait for 30 seconds and read all the pulse rate of the patients here. 30 seconds. After 30 seconds, we are now able to uh, remove this and just multiply the 30 seconds, the numbers that we counted to the 30 second, over the 30 seconds, we can count the pulse rate and multiply it into 2, since basically I got here for over 1 minute. I have counted 82 pulse rate for this patient, and that level or that rate for a patient is just basically um, proper. And also in getting the pulse rate, we have to remember that we have to take note of the irregular pump or irregular pulse of the patient. So since if there is no pulse, we are going to rate it 0, and from 0 we can count to plus or 1 plus and 2 plus. So on this patient, we were able to get the data, which the heart rate of this patient is 82, the rhyme is uh, just regular, and also the pulse scale is 2 plus, which is means that then the pulse scale of the patient is just normal and perfectly working. After that, we are going to take and gather all of this data of the patient and document them on our chart.